Healing our nation's heroes.
Compassion.
Invested.
A family.
I think one of the things that makes us different from other commands is our compassion, our dedication, and our ability to go above and beyond in everything that we do, taking care of our patient population.
Caring.
Caring.
Caring. Quality care.
Team.
I am Naval Hospital, Jacksonville.
I am Naval Hospital, Jacksonville.
I am Naval Hospital, Jacksonville.
We're the best at what we do. The 2,500 military, civilian, and contractors that dedicate their lives and their energy to take care of our nation's heroes, take care of our nation's families, and it doesn't matter whether they're past, present, or future. We take care of all of them, and we do it right here, and we do it better than anybody else.
In state-of-the-art operating suites, our general and subspecialty surgeons and staff deliver unsurpassed, evidence-based, family-centric care to meet the needs of our patients.
We're man-trained and equipped to provide that highest level of patient safety that's out there, that highest quality, that best outcome that you can have. You get right here, Naval Hospital, Jacksonville.
Naval Hospital, Jacksonville. It's a team, a family, with efficiency, with compassion, with one of the most talented and gifted medical staff. I don't feel at any time that I'm not connected with the team. This is a wonderful Naval Hospital, Jacksonville team.
I come to Naval Hospital Jacksonville for all these years, total of 24, is because I'm very confident in the care that I'm going to receive when I get here and how they're going to take care of me. The care I've received here at Naval Hospital Jacksonville has been awesome. It's been great. I couldn't ask for anything better.
Here at Naval Hospital Jacksonville, I felt very comfortable with the decision making for my care. I was in it from day one up until the end.
It's always good to know that Naval Hospital Jacksonville is always here just in case. Because my dad's my hero, and if anything happens to him, yeah, it's always good to know that he'll be taken care of.
Here at Naval Hospital Jacksonville, we have a dedicated team of military and civilian physicians, nurses, support staff, corpsmen, who truly go above and beyond every day to provide quality care for our patients. It has truly been one of the best places I have ever worked.
Why do I feel so stressed and out of it?
I haven't been sleeping or eating. I feel like an outsider in my own family.
Why am I so easily irritated? Who can I talk to about this?
Who can I talk to about this? The first step was the hardest, but as soon as I opened up and told someone about the thoughts I was having, I felt better immediately.
My healthcare provider helped me to work through the mental issues I was having, and pretty soon, they just weren't there anymore.
It wasn't easy, but taking that first step can make all the difference in the world.
Now I'm in control.
Now I'm in control.
Take control of your health. If you're feeling low, overly stressed, or even if you just want to get something off your chest, take the first step and share your concerns with someone. Together, we can improve your quality of life.
Today I actually came for my first ultrasound, me and my husband, and we got in really early, and they were all really nice and showed us everything we needed to see.
Being a military family, we were used to moving every few years. But how would it affect us now that we had kids? Luckily, we decided early to consult our military health care provider.
Can we take a listen to you and make sure everything's okay?
He answered all our questions and helped us put together a custom roadmap for her health. Now we know what to do to help prevent obesity, diabetes, and other health issues.
It's good to know we're instilling healthy habits early on in her life and ensuring we can all stay healthy as a family long term.
It's good to know we're in control.
Raising a child is definitely a challenge, but it's a challenge that should be rewarding and positive. Visit your healthcare provider on a regular basis to make sure you're taking advantage of preventive measures. Take control of your child's health and well-being. Put them on a path to a happy, healthy life.
Since I retired from the Navy, I've gone to so many doctors and started so many pills, I lost track of them. I knew it was time to start managing my medications better, but I didn't know where to start. I realized that the first step in getting my medications under control was to get actively involved. My healthcare provider advised me to make a full list of all of my medications and to even bring the bottles in if I wasn't sure what was what. I keep this list on me at all times and update it as my health needs change. Working together, we were able to actually cut out a number of medications. Now, whenever a new health issue comes up, I ask questions about doses, side effects, and the correct times and ways to take the medications. I no longer feel lost. I feel empowered.
It's easy to get back on track with your medications. Start a conversation with your healthcare provider or pharmacist today and take control of your health.
When I was able to get on this list and be able to come here, I think it's one-stop shop. I get my prescriptions filled, I get whatever I need to be seen for done, and labs are right here. It's great.
I used to think all I had to do for my heart was basically make sure it was beating. Then one day during a routine checkup, I realized there was a lot I didn't know about my heart and how I can take care of it. My healthcare provider told me that with my family history of heart problems and my cholesterol and blood pressure readings, there were a lot of issues I had to pay attention to. But he assured me there was still plenty of time to reverse those problems if I made some small lifestyle changes. To keep my weight under control, I'm doing light, regular activity and making smarter choices when it comes to my diet. And I feel like I have more energy than ever before. Now I'm in control of my heart health.
Heart disease is the leading cause of death for both men and women. But you have the power to change that. Eat as much healthy food as possible and get moving. Take control of your health. and make your heart happy.
In today's versatile Navy, a dynamic corpsman is needed. Naval Hospital Jacksonville answers that call with its 3 training programs: Hospital Corpsman University, or HMU, the new Independent Duty Corpsman Center of Excellence, and the Tactical Combat Casualty Care Program. Naval Hospital Jacksonville aims to provide a high-intensity and comprehensive approach to training, ensuring the best possible care is provided to their heroes at home as well as those deployed around the world.
We are committed to the fact that our staff really are what drives us and makes us better than anybody else, and gives us that ability to provide that safe, high-quality patient care that's so critical. And so we've got a comprehensive approach, and we've dedicated the resources and the assets to make it that.
For one sailor, the HMU program provided a more hands-on approach than the basic Naval Hospital Corpsman School that he believes is essential for all corpsmen.
Me and a lot of other people, I'm pretty sure, learn better with doing hands-on training as opposed to just writing everything down in a book and trying to memorize it. When you bring the book knowledge to trying to make it happen with your hands, you learn better and it sticks in your head a lot more. So that's why I liked HMU.
The Independent Duty Corpsman course provides high-intensity training, making it unique to all other similar courses. Their goal for this program is to train the Independent Duty Corpsmen for their eventual rotation back to arduous and isolated duty. The third course offered is the Tactical Combat Casualty Care Program, which is a requirement of all corpsmen to attend. This course provides field training focusing on combat-related trauma care. Naval Hospital Jacksonville's enhanced medical education for improving care and patient safety sets the standards for all Navy medical treatment facilities. From Naval Air Station Jacksonville, I'm Petty Officer Gary Granger, Jr.
Great benefit it is. The doctors, the staff, everybody here is amazing. I wouldn't go anywhere else, even if I could.
Getting diagnosed with diabetes is like having a heart attack or stroke. By the time you know you have it, you're already a statistic. Luckily, there's a number that's on your side. My healthcare provider helped me understand that knowing and monitoring my weight is the first key step in preventing this serious and growing disease. I learned that small, incremental changes to my lifestyle can help control my weight.
Whatever you like to do, do it.
With proper diet and activity, and regular meetings with my healthcare provider, I'm doing everything I can so I'm not at risk.
Take control of your health. Get a scale, know your weight, and talk to your healthcare provider about any questions or concerns. And remember, just a few small lifestyle changes can add up to a life free of diabetes. They've always taken care of me. They've taken great care of my wife and my son when he was here, now he's in the Air Force. So, but it's always been fantastic.
Darnell Cookman Middle School High School of Medical Arts played host to Naval Hospital Jacksonville's Science, Service, Medicine, and Mentoring Program, or S2M2, a program designed to encourage, nurture, and enhance high school students' interest in pursuing careers in science and medicine.
It's a phenomenal opportunity for our kids. The fact that some of these students will be able to apply and be selected to participate in a program at the Naval Hospital is an opportunity you can't miss.
During the event, Naval Hospital Jacksonville clinicians shared inspirational stories of their careers in Navy medicine and the paths they took to get there. Along with the formal event, smaller groups of students were able to spend quality time with the Navy clinicians in an open forum.
I did it this past summer and it was a really rewarding experience. We got to shadow doctors and I got to see a live birth and it really inspired me to go into Navy medicine.
From Jacksonville, I'm Jacob Sipple.
I'm in my early 30s. I stay pretty active. I thought I had years before I needed to worry about my bones and joints. I mean, conditions like arthritis and osteoporosis only affect old people, right? So why am I in pain? I put off telling my healthcare provider for as long as I could.
Hi, Mr. Smith. How are you? I'm Dr. Manhart.
When I finally went in, I was happy to find out that I still had a lot of time to work on my bone and joint health. My healthcare team is helping me work on my diet and exercise habits. I'm keeping my weight under control and doing activities that cut down the risk of damage and injury. Now I'm in control of my health.
Remember, even just 20 minutes of exercise a day can prevent osteoporosis and arthritis. Take control of your health. See your healthcare provider.
I always feel like I'm treated with respect and that we're both important to everyone.
Thanks to an agreement between Naval Hospital Jacksonville and the Department of Veterans Affairs, accessibility to healthcare services has been expanded for almost 6,000 veterans and 1,500 active duty military living in the Albany, Georgia area. The agreement relocates VA healthcare providers and services to Naval Hospital Jacksonville's Branch Health Clinic Albany, aboard the Marine Corps Logistics Base.
Combining Navy medicine and VA resources brings the best in patient care, not only to the active duty but also our veterans in Albany. So by collaborating together, we not only enhance and expand patient care, but we also are able to do it in a more cost-effective way, therefore being good stewards of taxpayer dollars.
The VA relocation to Branch Health Clinic Albany's 22,179 square foot building provides veterans a state-of-the-art facility and access to new ancillary services such as pharmacy, laboratory, and radiology. They will also have expanded access to services historically received, from primary care to mental health.
One thing, we think our veterans would be so happy coming here. Once a military person, always a military person. We think they'll be right at home coming on base here. I know they'll be welcomed by the Marine as well as the Naval staff here. We really look forward to having them come here.
From Albany, Georgia, I'm Jacob Sipple.
I'm active, I take care of myself, and my husband and I are starting a family. Home and work life are stressful enough. So I shouldn't have to worry about my health for a while, right? That's what I assumed, until I sat down with my healthcare provider. A visit to your provider is the best chance to take control of your health, to share with your doctor and ask questions in a private, friendly environment, to find out your unique health risks and the rewards that can come from preventing health problems before they start. My life isn't slowing down, but it's good to know that I'm in control.
No matter your age, your background, or health issues, there's always something you can do to improve your lifestyle. Most of these issues can be addressed with just a small adjustment to your diet and your daily routine. Take control of your health. Visit your healthcare provider for more information.
I know I'm not going to be able to treat everybody for everything. I just knew I had to give everything I had to everybody who was on the ship.
We're going to go to our neighbors around the world and show them that we have compassion.
We take care of people who have so little.
You can put this ship off the coast anywhere, and it is a symbol of we're here to help. We're also here to learn as much from your country as you can from us.
If you were to take John Hopkins or Walter Reed and put it inside the skin of a ship, that's what we have.
We have digital x-ray, we have dental, we have optometry.
We have a CAT scan machine.
12 operating rooms as well as an interventional radiology suite.
We have our own oxygen plant that produces medical oxygen.
80 ICU beds and hundreds of ward beds.
So anything you could do at a Navy or civilian hospital, we can do it here. The only difference is we can come to you instead of you having to come to us.
Operation Continuing Promise is actually a regular deployment schedule where we take the USNS Comfort to Central and South America. The countries vary a little bit.
We work with the ministries of health to be able to build a partnership of caring, a partnership of learning and education.
We made a promise to these countries that we visited that in any time that they're going to have a need for us to come down and help them, that we would be back.
I was driving home from work, and as I was driving, I started hearing about the earthquake.
And I told my wife, I said, well, I've got to get my sea bag ready because I'm going to be getting a phone call tomorrow. We're going to go down to Haiti probably by the end of the week.
I really felt that this is what I've been preparing my entire life for.
For Operation Unified Response, the ship was underway in 76 hours.
On the way down to Haiti, we kept receiving a lot of information via email about hundreds, thousands, tens of thousands of people, primarily with orthopedic injuries. But it's one thing to see a couple of pictures on the internet, another thing to know that you're actually going to be a part of the human element of what we see, the devastation. The fact that that suffering was going to be coming on board in numbers that we had no idea of how many or for how long.
When we're about 100 miles out, we started getting patients. We went nonstop the first 3 days.
About every 90 seconds, those elevator doors open, and here come more and more patients, and they just kept coming. Then there would be about a 20-minute delay, the next round of helicopters, and there would be more and more coming.
Anywhere from newborns that didn't have any family left up to, senior citizens.
So it's kind of like a mayhem because you've got two different cultures, you've got different types of understanding of the disease process.
So each and every patient that would come in, I would spend some time with an interpreter to understand their story, because everyone seemed to be, the next one seemed to be worse than the previous one. You couldn't make this stuff up. We had an individual who was approximately 28 years old, and he had a very bad injury right over his elbow on his dominant arm. Basically, it took out the joint itself. Now, the interesting thing with him was this part worked just fine. So he knew that he was probably going to have an amputation. But in talking to him, he has a family, he has dreams for his kids. So I was with my colleague, a hand surgeon, Dr. Rulin, and we looked and we saw that he may not have an elbow, but what about if we just connect the bones up? If we can get the bones to heal, he won't have any motion across the elbow, or what was the elbow, but he'll still have the use of his hand. We took him back after the surgery into the recovery room. The first thing he did when he woke up is he kind of looked down to see if he had a hand. He saw his hand, he grabbed it just like he did before, picked it up. It works, it works.
I think in the big picture, the big scheme of things, having the comfort and the mercy shows the rest of the world that we're not just out there to go, drop bombs in the desert and fight wars. We can project a positive image and soft power on the rest of the country, rest of the world, and maybe change some people's opinions about us.
We are military, but we're in a big white ship. As a matter of fact, many places we go, when they see us off the coast, they call us the Great White Angel from America. Every site, hundreds and hundreds of surgeries, lives that are changed, and impressions that are altered for the benefit of the United States of America and our partner and host nations as well.
From a humanitarian assistance perspective, there's not anything more rewarding that you can do truly in the Navy.
Naval Hospital Jacksonville becomes the third military installation to become baby-friendly during an announcement held at Naval Air Station Jacksonville.
It's my pleasure to announce today that Naval Hospital Jacksonville is the first hospital on Florida's first coast to receive the International Baby-Friendly certification.
The certification is given to hospitals that successfully implement the recommended 10 steps of a comprehensive breastfeeding program to give mothers the information, confidence, and skills needed to successfully initiate and continue breastfeeding.
The hospital's helped us out tremendously. The staff has been awesome. They have helped when I was in the hospital with him. They would spend hours in the room with us trying to help him.
While more than 20,000 facilities have received the baby-friendly designation worldwide, only 119 facilities have been certified in the United States. From Naval Air Station Jacksonville, I'm Petty Officer Jacob Sipple.
You may not realize it, but if you smoke or have ever tried to quit smoking, you are an addict for life. Whether you're like me using tobacco regularly, or if you just smoke occasionally, there's something else you may not know. You are not alone.
Good morning, everyone. My name is Brooke.
I'm in my 3rd month of no tobacco.
Good morning. Come on in and have a seat.
And even though I relapsed a couple of times, I know I'm on my way to changing myself and my mind for the better.
If you need anything, we're here.
I know I can quit,
No embarrassment. It's an addiction.
but I also know now that I need help to do it.
I'm a former smoker who knows how much harder it is to quit than the one-syllable word implies. I also know how possible it is to actually do it. Take control of your health, see your healthcare provider, and move beyond tobacco.
I'm in my late 20s. I work out, I look after myself, and I try to stay focused on my career. So why worry about my health now? A visit with your healthcare provider is the best time and place to learn about your health risks and make sure you're taking preventive steps for a lifetime of good health. All right, sounds good. Thank you very much for your help.
You're welcome.
I appreciate it. In our busy line of work, staying on top of health concerns doesn't have to add to the stress. I learned there are a lot of easy changes you can make to your everyday life to take control of your health before any issues come up.
No matter your age or background, you can always find ways to prevent disease and injury later in life. With simple steps like eating healthy and exercising 30 minutes a day, you can assure yourself the best possible health as you move forward with your career and home life. Take control of your health. Visit your healthcare provider and get on the road to prevention.
More than 400 regional healthcare leaders and clinicians attended the Jacksonville Business Journal's 10th annual Healthcare Heroes event held at University of North Florida. The event honors Northeast Florida healthcare professionals who improve healthcare and save lives.
Honoring healthcare professionals in the military is one of the most rewarding things that we do when we go through the selection process.
Of the 118 award nominations, 30 clinicians were recognized from various healthcare organizations around Northeast Florida. 3 awardees were Naval Hospital Jacksonville clinicians.
It's wonderful to be in a location where the community is so supportive of Navy medicine.
This is a great opportunity to say thank you to our staff who provide outstanding care every day at Naval Hospital Jacksonville.
From Jacksonville, I'm Jacob Sipple. This is Naval Hospital Jacksonville's Sexual Assault Forensic Exam Room, or SAFE Room, where we care for patients who have experienced sexual assault. This is a room we hope stays empty, but our clinical staff is well trained to be there for patients who need us. This is Naval Hospital Jacksonville's Sexual Assault Forensic Exam Room, or SAFE Room, where we care for patients who have experienced sexual assault. This is a room we hope stays empty, but our clinical staff is well trained to be there for patients who need us.
Here at Naval Hospital Jacksonville, we want to make sure that our providers are well trained, that they are prepared and ready to perform this forensic examination if a patient should arrive. We want to make sure that we're giving that patient the best care possible.
I hope that any potential victim can, feel comfortable to know that they will be taken care of within our command, and knowing that, if this ever were to happen to them, I hope that they feel the confidence and courage to speak up, not just for them, but for everyone that didn't have the courage before them to speak up.
When we found out we were pregnant, we were ecstatic at first. We realized we had a lot of questions we didn't know how to answer.
From the very first visit with our healthcare provider, we already felt better. He went through all the stages of pregnancy and early infancy with us and told us what to do if we needed help.
We felt nervous asking questions at first, but realized that questions are the best way to get the information we need.
Not only were we prepared for when the baby came, but now that we're raising our first child, we know what to expect.
Now we're in control and can concentrate on what's most important.
Starting a family is an exciting and challenging big step, but there are resources at your fingertips to make the transition as smooth as possible. Ask early, ask often, and take an active role in knowing what to expect. Take control of your baby's health. Visit your healthcare provider.
Students from Darnell Cookman School of Medical Arts recently participated in Naval Hospital Jacksonville's annual Science, Service, Medicine, and Mentoring Program, or S2M2. 10 selected students engaged in workshops and job shadowing with Naval Hospital Jacksonville clinicians, rotating through various hospital areas receiving real-world experience in patient care.
We look at this as an opportunity to connect with interested students in the community, those who are already pursuing academics, whether it be in medicine, veterinary science, forensics, just to kindle that fire so that we can share our experiences and show them what opportunities are out there in medicine and how broad a field this is to help people.
The goal of Naval Hospital Jacksonville's S2M2 program is to encourage, nurture, and enhance high school students' commitment to science and medicine in a welcoming and intellectual stimulating environment.
The partnership that Darnell Cookman has established with the Naval Hospital Jacksonville is one that is invaluable because of our background being a medical magnet and Jacksonville having such a large naval community. It marries our purpose at our school with the community at large.
The S2M2 partnership with Darnell Cookman complements the school's focus on equipping high-performance students with the skills and experiences to pursue advanced medical degrees.
As a group, we've learned how to use all the different equipment, all the techniques that were used to help the patients in the Naval Hospital.
Well, this week has been amazing. We've got to tour the hospital. This has helped me decide what field of medicine I want to go into. Like, we've got to see births, and so I got to swaddle a baby, so I can decide. It helps me decide what I want to do.
From Jacksonville, I'm Jacob Sipple.
The far cortex is